New York health officials are now investigating 85 cases of a rare pediatric inflammatory syndrome believed to be linked to COVID-19, Gov Andrew Cuomo announced at a press briefing on Sunday.
At least 3 young children in the state have died from the illness and another 2 deaths are under investigation, Cuomo said.
This is an issue that people need to be aware of, he said, noting that it is affecting toddlers and elementary school-age children.
Cuomo said that the New York Department of Health is notifying other states about the illness because it is probable that it's occurring at a similarly alarming rate outside of New York.
Symptoms of the illness are similar to those seen in Kawasaki disease and toxic shock-like syndrome, including persistent fever, rash, abdominal pain and vomiting.
This does not present as a normal COVID case. COVID cases tend to be respiratory. This presents as an inflammation of the blood vessels, sometimes inflammation of the heart, Cuomo said.
It's possible these cases were coming in but were not diagnosed as related to COVID because they don't appear as COVID, but it is a situation that has taken the life of 3 New Yorkers.
Children are being admitted in what has been described as a multi-system inflammatory state.
This refers to the overproduction of cytokines, known as a cytokine storm, the overreaction of the body's immune system.
In a storm, the proteins start to attack healthy tissue, which can cause blood vessels to leak and lead to low blood pressure.
Doctors say this also happens with Ebola, causing the body to go into shock.
It has also been noted in older COVID-19 patients.
What symptoms does it cause?
The cases share overlapping features of toxic shock syndrome and atypical Kawasaki disease.
2 of the most common symptoms of Kawasaki disease include a rash and a fever.
TSS also causes a rash, dizziness and diarrhea.
New York City Mayor Bill de Blasio also voiced tremendous concern over the uptick in cases on Sunday, as he confirmed that 38 had been detected in the Big Apple and an additional 9 are awaiting confirmation.
What it does is, basically, in a child's body triggers an intensive, almost overwhelming immune system response. And that actually causes harm to the body, de Blasio said Sunday.
The mayor said all children with associated symptoms would now be tested for COVID-19 as well as antibodies.
So far, of the confirmed cases, 47% had tested positive for coronavirus and 81% had antibodies, indicating exposure to the fast-spreading virus at some point.
De Blasio urged all parents whose children exhibited the symptoms to seek immediate medical attention.
Efforts are underway to collect information on the disorder, dubbed pediatric multi-system inflammatory syndrome, potentially associated with COVID-19.
On Wednesday, the New York State Department of Health issued an alert, calling on hospitals to immediately report any cases to the department.
Cases of rare, life-threatening inflammatory illnesses in children associated with exposure to COVID-19 were first reported in Britain, Italy and Spain.
However, doctors across the U.S., such as in California, New York and New Jersey, are starting to report clusters of kids with the disorder, which can attack multiple organs, impair heart function and weaken heart arteries.
Doctors say its symptoms bear striking similarity to Kawasaki disease, a mysterious illness that primarily affects children up to the age of 5 and causes the walls of arteries to become inflamed, resulting in fever, skin peeling and joint pain.
Cuomo announced the first known death from the illness. A 5-year-old had died at an NYC hospital, on Friday.
On Saturday he revealed that 2 other children, a 7-year-old in Westchester County and a teenager in Suffolk County, had also died.
Cuomo said children had tested positive for COVID-19 or the antibodies but did not show the common symptoms of the virus when they were hospitalized.
This is the last thing that we need at this time, with all that is going on, with all the anxiety we have now for parents to have to worry about whether or not their youngster was infected, he said at his daily briefing.
New York is helping develop national criteria for identifying and responding to the syndrome at the request of the Centers for Disease Control, Cuomo said.
There is no proof that the inflammatory syndrome in children is linked to COVID-19.
Doctors still believe that most children with COVID-19 develop only mild illness and most will recover.